Hello, everyone, and welcome to another episode of the Root of the Suns podcast with your girl, Anne with an E. If you are new here, welcome. It is such a pleasure to have you here. If you are returning, thank you so much for returning to another episode. So, today is our first episode of our series titled Rooted in Health. This is a series in collaboration with Global Health Strategies. Our first episode is titled The HPV Vaccine and the Future of Women's Health. In this episode, we examine the significant burden of cervical cancer across Africa and the crucial role that the HPV vaccine can have in addressing this issue. We are joined by Dr. Cornelia Ndifon, a medical practitioner and a public health expert with 29 years of experience across Africa, the UK, and the US. As a member of the CPHIA 2023 Scientific Program Committee and a medical director of the Sterling Medical Center, Dr. Ndifon brings in invaluable insights in our conversation on the HPV vaccine. With her expertise in maternal and fetal health, research, and global health security, Dr. Ndifon will help us understand what HPV does to the body, firstly, and then we'll discuss how the vaccine is important in minimizing the effects of the HPV vaccine. We will also discuss the role that communities and policymakers have in terms of vaccine acceptance. Further, she will share some personal stories from her many years of experience. Join us for all of this and, of course, so much more. Let's go. Hello, Dr. Cornelia. Welcome to the show.
Yes, thank you, Anne. And I wish to say it is my pleasure to be invited to do this podcast all the way from Windhoek, Namibia. And I would like to say hello, listeners, because you may be going to listen to this podcast either very early in the morning or afternoon or evening. Whenever that time is, I am saying hello from my office in Windhoek, Namibia.
Lovely. Thank you so much, Doc. Yes, hello to everybody. It is Women's Day in South Africa today when we are recording this. So happy Women's Day from myself to all the women out there. It is such an honor to have you on. So Dr. Cornelia, just to get things started, would you kindly introduce yourself? You've already told us that you're coming live from Windhoek, which is in Namibia. So briefly, where you based? What do you do?
Yeah, thank you very much. So my full names are Cornelia Ndifon. I am a medical doctor and a general practitioner running my own private practice, which is based in Windhoek in Namibia. The name of my practice is Sterling Medical Center. I do hold 2 master's degrees, one in public health and another one in research from the University of Leeds and Manchester, both in the UK. I've been working in the public health field for over 15 years, up till last year, 2023, when I left a Johns Hopkins program, which is called JAPIGO, to come and set up my own private practice. My focus is women's health because some years back, I was doing what we call residency in obstetrics and gynecology. But I lost a loved one and that affected me. And so I shifted from that obst and gynae consultancy training to do Masters of Public Health. And looking back now, I have no regrets whatsoever because I have worked not only in Nigeria, but I've worked in Guyana under the United Nations program. I have also worked in Mozambique, and I came to Namibia in 2008. So I've been residing here for 16 years as a permanent resident. And so in my practice, I do general practice, like I said, seeing everybody from 4 months old to 90 years.
Wow.
But in heart, there's a special interest in gynecology because of my love to see that women get the care that they need. And so when it comes to women's health, I'm very much interested in cervical cancer prevention. And therefore, every woman that walks into my private practice, I make sure I ask them if they have ever had a pap smear, or screened themselves for cervical cancer. And from their responses, we take it from there. So yes, I'm a general practitioner at the moment, running my private practice with a focus on women's health. Thank you.
Lovely. Thank you so much for that overview, Dr. Cornelia. It's lovely to see that you've got such a vast experience, and also not just experience in terms of theoretical, but also just that personal experience aspect. You mentioned that you recently finished a fellowship. And I wanted to ask you, with all of this travel, studying abroad, etc., what inspired you to come back to Africa and really focus your work in terms of health innovations, particularly back here in Africa?
Yeah, thank you so much. Education is such an eye-opener. Without having to travel to every single African country, but through research, through literature review, through assignments, you get to know about what is happening in regards to health. Okay. And so my master's dissertation was talking about access to skilled obstetric care in my state, my state of origin, which is Cross River State in Nigeria. And like I said, for me to be able to complete a whole dissertation, I have to look at access to skilled obstetric care in other low and middle income countries, not just even African countries. Yeah. And that led me to know that Africa is still very much behind. And I also did the Masters of Research, like I said, in Manchester, where I was looking at intrauterine growth restriction, or growth restriction in general, whereby a fetus in the mother's womb is not growing properly. Again, doing a literature review is an eye-opener. You get to know the problems of other countries. And you now put Africa and you say, where are we?
Yeah.
When you see that Africa is lagging behind, there is an individual or personal nudge that is saying to you, when I get this certificate, what am I going to do next? How will the woman or the people that were not as advantaged as myself to get education, what am I going to do differently? And honestly speaking, that is why I love public health so much. And I had opportunities now to work in programs. For example, what brought me to Namibia was as HIV clinical mentor in 2008 under the University of Washington program that is called ITEC. I didn't just come to the capital city of Namibia. I went into the rural areas, and that again was a huge eye-opener. African women, or Africans in general, it's like even when our own people have opportunities, it's like, oh, I'm fine now. I'm in New York. I can just stay there. Nobody wants to come back to where we came from.
Yeah.
And try to see what we can do. So for me, I love Africa, if I can say so. I love women. These are my roots.
Yeah.
And I have been opportune to get this education. I thought to myself, any chance to go back to the rural areas, to go back to the villages, to go back to where the need is, I am going to take it. And precisely that is what I have done since I got my MPH in 2003. That is like 20 years ago.
Wow, Doc. You can hear the passion just coming out of the way that you speak, your love for Africa and your love for women. And, bringing that closer, you mentioned that you have your own private practice and you said that you try to educate women on women's health, particularly cervical cancer. So some of our listeners are probably have heard the name, for example, but they're unaware what it is and why it's something that we as women should be informed about it. So could you give us a brief overview?
Okay. So basically, cervical cancer from that name is cancer originating from the cervix. I won't blame any woman that doesn't know, because just like we tend to call everything abdomen, stomach.
Yes.
But inside the abdomen, there are very many organs. The liver, the spleen, the kidneys, which we don't see with our naked eyes. The same thing with the reproductive system of the woman. The cervix, a normal cervix, cannot be seen by the naked eye and should not be seen. So if people don't know what is cervix, please don't worry. Cervix is the neck of the womb. That is the language we use to describe to a lay person, the neck of the womb. Now, when a woman gets pregnant, the baby in a normal pregnancy grows in the womb. When it is term or 9 months or baby is mature to come into this world, for normal vaginal delivery, that baby will pass through the cervix. During sexual intercourse between a man and a woman, the sperm that is going to fertilize the egg passes through the cervix. So the cervix is very important. Now, cancer of the cervix is cancer that originates from that cervix, which, like I said, in layman terms, is called neck of the womb. Now, what causes cancer of the cervix? There are thousands of microorganisms or pathogens on Earth. You have bacteria, you have viruses, you have fungi. But it is a virus known as the human papilloma virus. That is what causes, I tell you, more than 92% of cervical cancers.
Sure.
And it is a sexually transmitted infection or virus.
92%. What a shocking statistic.
Yes.
That is very, very shocking. So we are talking about HPV, or the human papilloma virus. I hope I said it correctly. So then with these statistics, there are preventative measures. There's been the HPV vaccine that has been developed. So what is this vaccine? Why is it so important for women's health overall?
Yes. So, as the name implies, human papillomavirus vaccine is a vaccine that has been designed to sort of inhibit or work against the human papillomavirus. That vaccine, by working against the virus, it protects the woman from getting infected with the virus following exposure. So this is the process. When there is unprotected sexual intercourse, semen or sperm is deposited in the woman. That act, if that semen is harboring the human papillomavirus, that woman will be said to have been exposed, but not yet infected.
Okay.
When a girl child is then given the human papillomavirus vaccine, the vaccine goes ahead to create a barrier that prevents human papillomavirus itself from establishing and causing infection, even if the woman has been exposed to it. So the vaccine prevents against infection with the virus. Now, once that infection with the virus is prevented, what do we get next?
Yeah.
Cervical cancer does not develop. The injury, the harm to the tissue of the cervix that is going to lead to cancer is terminated. In fact, is not initiated in some cases because that woman's body, including that cervical environment, is antagonistic to the HPV because the vaccine is working. The vaccine has gone ahead before that exposure. Why is this important? Apart from just cervical cancer, because depending on the immune system of a woman that may be so exposed, HPV does not only cause cervical cancer. It can cause cancer of the vagina itself. It can cause cancer of the vulva. It can cause cancer of the throat. And you are wondering why. Remember, there are different ways that different cultures and people practice sexual activity. So just like we have heard of MSM, there's also oral sex. And some HPV types, they cause throat cancer and even anal cancer. Since cervix is very unique to the woman, you can say that cervical cancer happens only in women with a cervix. But anus, a man also has an anus. A man also has a throat.
Yeah.
And apart from the specific HPV subtypes that cause cervical cancer, there are other subtypes that cause, like I said, anal cancer, penile cancer, throat cancer. And penis, of course, restricted to the men, but meaning that a woman may not even have cervical cancer, could come up with vaginal cancer, could come up with vulvar cancer. What else does HPV cause? Genital warts. Now, genital warts are not cancers, and so therefore somebody may not die, but my dear, they could be very unsightly because these warts, they are, like some pimples, and not just simple pimples, they're like huge collection of growths, Sometimes they cover the entire vaginal introitus. And to be very honest, a human being has a right to sexual activity. And imagine a person or a woman having so many warts in the a private area. It will put off a partner.
Yeah.
And because of that, it can become very emotionally distressful. And so the HPV vaccines that we have there in the market, they are able to not only prevent cervical cancer, but they can also prevent these cervical warts, which, like I said, they can be utterly distressful to the eyes.
Wow, Dr. Cornelia, you have explained this so thoroughly. Thank you for that. I think I'm sitting here and I'm like, okay, now that I know how this happens, how do I know if I'm exposed? Because like you said, that, humans have the right to engage in sexual activity. So how do we go about to know that if I am exposed? Because you said there's a difference between exposure and infection. So I think it's the detection part. How do we know?
Excellent question. So I am also an advocate of adults should be free to discuss sexual activity. And I want to say it to any adult female or male listening to me that if you have ever had sex, you may have been exposed. You may have been exposed, and there's nothing wrong with that. Just know that probably 99% of anyone that has ever had sex has been exposed to HPV. So how do you know that? Go for HPV test. With women, through the pap smear, when we do the pap smear, preferably the liquid-based cytology type. For me as a doctor, when I do pap smear for my female patients, I request for HPV testing and or typing. So they can just detect that HPV is present. And typing goes an extra mile to say what specific type, because reading scientific articles and medical textbooks, we know that there are more than 100 HPV subtypes in the universe, if I can say that.
Yeah.
But two, type 16 and 18, are the major culprits for cervical cancer. And then you have type 6 and 11 and others that are implicated in these genital warts. So whenever we do pap smear, it is good to, in addition, check for HPV, because that is actually the cause of cancer. So doing a pap smear without checking for HPV, to me, I know that there is cost implication, but prevention, we say, is better than cure.
Yeah.
If HPV is present, then we can go further, and I'm talking about women now, to do another kind of test that gives you some kind of immediate result. Because pap smear, you take the swab, you send, you wait for the result to come. And if you do the HPV testing at the same time, you also get the result. Now, if HPV infection is detected, then it is advisable to do further investigations to determine the presence of this HPV. Has it done damage to the tissues already? And to what extent? Because cervical cancer, while it is deadly, it has a long time to get there. Sometimes as long as 10 to 15 years, depending on the immune system, of the woman. And so when we do the pap smear and we get the result and combine it with HPV testing, it helps us to say, okay, are we dealing with the first process towards cancer? Are we at the second level towards cancer? Or are we at the third level, which is now I would say the dangerous phase? Because when you say this is a third level, it's as good as, are we having a quiet cancer already that we cannot see with the naked eye? Yes. So to know whether you have been infected, because I said sexual activity automatically means exposure.
Yes.
But have you been infected? You can only confirm that by doing an HPV test.
Fantastic. So now we understand that. You mentioned the idea that prevention is better than cure. So there is an HPV vaccine that is available. So when does that happen? Is it for people who are engaged already in sexual activity, or can you take it when you are much younger, before you start engaging in sexual activity, so that when you do and you are exposed, this could help prevent ultimately?
Yes, thank you very much. So there is HPV vaccine, and that's what we are talking about.
Yes.
The World Health Organization, which I will say on this earth is the mother of Health Matters globally recommends HPV vaccination of young girls between the age of 9 to 14. Because, candidly speaking, across all cultures, normally girls of this age wouldn't have started feeling or desiring sexual intercourse. If you find people of this age engage in sexual activity, you may just consider some form of abuse going on somewhere.
Yes.
So girls 9 to 14 most likely never been exposed. And that is the recommended age by WHO for introduction of the human papilloma virus.
Good to
before
know.
Sexual activity.
Speaking of the African context, Doc, vaccine hesitancy is a huge problem. We saw it during COVID in full bright colors. But of course, the HPV vaccine has been there before COVID. So what are some of the challenges for an African girl child at age 9 to 15 in terms of, vaccine taking the HPV vaccine?
Yes, I'm happy you brought the issue of COVID-19 vaccine. The vaccine hesitancy has even been there before COVID. I don't know what happened. I don't have the details of the science, but the MMR vaccine, for whatever reason, people started to have issues with the mumps, measles, and rubella vaccine. And then with social media, with smartphones, with access to data and internet, conspiracy theories started to fly. And you and I know that anybody can have a smartphone, but that does not really mean they are quite educated.
Yes.
That does not really mean they have any science. That does not really mean they even understand the grammar. That does not even mean they understand the motive of the speaker in a particular video. And most conspiracy theories, their aim is to, should I say, spread fear or inject fear. So this is what has caused vaccine hesitancy. From MMR to COVID-19, like you said, it came full-blown, all dimensions. Imagine people receiving videos and saying something will kill them, something wants to eliminate, and all those things. And some people have these smartphones, like I said, maybe in the rural areas. They have a smartphone because whatever. But do they even understand what they are listening to? So that has been our greatest challenge, that the information out there hasn't been accurate. The information out there has at best gone out to create fear. And who wants to die? We want to go to heaven, but we don't want to die to go to heaven.
Yeah.
Yes. So that is precisely what has happened there. But we can do something about these challenges, of misinformation. There is, of course, the challenge of cost on one hand. I don't depend on cost alone because, like we are saying, sometimes the vaccine is even there, it meaning that it's not a problem of cost to the government, but no one is going for it because of that misinformation. Another challenge is that people, even if they don't have a smartphone to hear what is happening in social media, They don't physically see healthcare workers, for example, or anybody coming to talk to them about cervical cancer, that it is not all about witches have killed my auntie, but it is a microorganism, and there is a means of preventing. And when adults who are now sexually active, even if they do not take the vaccine, they are in a very solid position, to enlighten the young girls that this vaccine is good. It has been tested, is safe, and it has a chance of prolonging your life. From the time you start sexual activity, have children, and so on, if you are covered by vaccine, the chances of you living longer are higher than you going into sexual activity, having children, and not being protected by vaccine.
That's good to know. I wanted to ask if we could further that to then. So what strategies, you've mentioned some of these challenges, the fact that vaccines are there, but people are not wanting to take them. So what strategies are there to have people, so that they can actually take this life-saving vaccine? And maybe you can use examples from your own work in your own private practice, for example.
Good. So there are many strategies we can apply in different ways. Using myself as a healthcare worker, and now I'm speaking to all healthcare workers, that any adult woman, like I said, is already sexually exposed to HPV and therefore is at risk of developing cervical cancer. So these people, we should give information. Then we are not giving vaccine, we are going to screen, but they may have children. So we need to find time to talk a little more about cervical cancer, what causes it, how it's prevented. We screen the mother and tell them about HPV vaccine so that they can talk to their family members. We can also colonize the social media, if I can say so, with authentic, scientific, and factual information, and counter engage other, should I say, other sectors of the society. What is Ministry of Education's role in the prevention of cervical cancer? Some countries or some governments have Ministry of Education, and then they have Ministry of Women Affairs. Some even have Ministry of Gender and Family, name it whatever. But anything that has to do with a woman, can we get these people into one room, give them the most basic factual information that they can replicate? They don't all have to be medical doctors. Teachers deal with school kids.
Yeah.
If management in the ministries of education, if school principals know and understand the impact of cervical cancer on a mother, on a family, then they will be equipped and also advocate for vaccination of the girl child. And even the WHO does also recommend vaccination of boys. But of course, I'm saying that everybody, all hands should be on deck to address cervical cancer. Cervical cancer is about mothers. Is there anybody without a mother? Is there a president? Is there a pauper? who is there without a mother? Cervical cancer is about sisters. Cervical cancer is about our aunties. And we all want to go to that auntie. We all desire a sister.
Mm.
So all hands should be on deck. But we are talking about HPV vaccination for young girls. And where will we get a cluster of young girls? It will be in school.
Mm.
Yes, because nowadays, in some countries, in fact, you could be punished for not sending a kid to school. And teachers are educators. So, Ministry of Education must be involved from the management down to the teachers who have direct contact with the children. That they don't need to be doctors. Like I'm saying, they are educationists.
Yeah.
We should engage with them, give them the basic message, the basic factual message that they can inform their school kids, they can inform the parents through Parents Teachers Association. I also said that other countries have ministries of women affairs. Sometimes they call them gender and all of those things. These should come together. They should know about cervical cancer because honestly, I don't think motherless babies are happy growing up without a mother.
Mm.
I don't think they are. And when there is no mother, because people are dying in their 30s and 40s, what will happen to the children? Though they don't die, they grow up, but what would have been their opportunities in life?
Mm.
It will be maybe very minimal.
Yeah.
And therefore, as a country, if people haven't developed because they don't have that support system, what does that tell us?
Mm.
You know, they used to say, if you educate a girl child, you educate a village.
Yeah.
The woman, you know, sometimes the world is like they have so much expectation from the woman, but it's like they haven't put in enough. So we must get everybody to participate. And if we identify community-based organizations that are doing something in their own way, can we get into what they are doing and say something to them about cervical cancer, say something to them about HPV vaccination, and maybe they can add it to their activities and spread the word, so that people will begin to, there must be demand and supply.
Yeah.
If we don't talk about cervical cancer prevention, if we don't raise that momentum, if we don't make noise, people are not going to hear and they are not going to come for further questions. I want to be able to see somebody walk into my clinic, not because they are having symptoms of cervical cancer, but they are saying, I've heard about cervical cancer, I've heard about HPV vaccine. I wanted to come and have a one-on-one with you because I'm interested. If somebody sees me on a shopping mall and happens to know that I'm a medical doctor, they should be able to say, doctor, can I pull you by the corner? Tell me about HPV vaccination because I'm having 2 young girls,
Yes. Yeah.
I don't want them to die at 25 because HIV infected women that are more at risk of developing this cervical cancer have actually died at the age of 25. Can you even imagine that?
Mm.
Can you imagine that? And in Africa, we love our families. We love reproduction. We love children.
Yes.
Some of these people die at 25, leaving 3 children behind.
Devastating.
How is that even soothing to the mind? It cannot be. So we need to raise even beyond this August month, that like by the time this August month is done, and we are in September, we are saying, let us review. We should be getting calls in September. We should be getting text messages in the newspapers. We should be getting, postings where people are saying, I want HPV vaccine for my girls. Where can I get it? And that should come as a wake-up call to government.
Yes. That story that you highlighted about the 2 young 25-year-olds, it really highlights the impact that cervical cancer and ultimately HPV has on the global health community. And in your last word, you spoke on the idea of governments, and I'm glad that you brought that in, because also earlier you spoke on the idea of collaborations. So you've got governments, you've got the teachers, for example, in terms of education. But I'd like us to then maybe also speak on the funding aspect, because money is important. There could be people who are, okay, yes, Dr. Cornelia, I want to talk to my learners about this. But what about the funding? So can you talk to us about that aspect in financing this HPV vaccine?
Yes, and you will agree with me that science is not cheap.
Yes.
So funding is key. Even we need funding to talk. We need funding to make a call. We need funding to send a text message. For any nation to embark on a national program for HPV vaccination, they need a very solid budget. Okay? Some countries are very wealthy and some countries are not so wealthy. Now, I know that globally there is a malaria consortium. There is also the Global Fund to fight HIV, malaria, and tuberculosis.
TB, yes.
I am asking, can there not be a consortium on cervical cancer prevention? Can there not be a global body to eliminate cervical cancer? And if there are countries that are so passionate, these countries can already come together to have that HPV prevention consortium, cervical cancer prevention consortium, whatever. And by coming together, they can begin to ask for donors. We have multilateral companies. We can approach them, or that consortium can approach them to ask for funding support. Forbes magazine, now and again, shares information about the richest people on the planet. Where is their money? I said before that everybody was born by a woman.
Yeah.
Including a president or a billionaire. A consortium that is HPV or cervical cancer centered, elimination centered, will go a long way to source for funds. And when they get this funding, it can trickle down to project implementation level. Like I said, either through agencies, through community-based organizations, through government institutions, through government departments, right down to me and you. If we have to go to certain schools and provide snacks, provide some tea and drinking water, and just make people happy as they listen to us, it will go a long way. Such money can even go into mass production of the vaccines. And in doing that, it will lower the cost of the vaccines. And more people might be just interested to say, I can buy 1 million doses, and donate for this cause.
That's true. While you were speaking, Doc, I was thinking, that's true that a global consortium needs to exist. And I quickly did a Google check on my phone while you're speaking, and it seems like it does. There is a global HPV consortium by the Sabine Vaccine Institute. But I think the key and the call to action here is that there should be more. The fact that for HIV, TB, it's well known and well established. It shouldn't be just these one, too few that exist. I think there needs to be more, because this is an issue that will forever be an issue. There's always going to be women, and there's always going to be people who are involved in sexual activity. So it's not going to be an issue that will just disappear. And I think like you said, science is expensive. Science is very, very expensive. And I think it's very important to speak on the idea of funding. As we are wrapping up, we've had such a wonderful conversation with you. And we can just hear about your passion. I'd like to ask you as the last final question, what keeps you motivated? Because this thing is not easy. It's not easy championing a cause like this. It's not easy seeing some of the devastating cases that you see, whether it's the stories or the actually seeing them as a doctor. So what keeps you motivated in the work that you do, particularly in women's health?
Ooh, that's a very good question. Whenever I wake up, you see, it's like I'm constantly aware that there is work to do. Like we started in the opening, that Africa is not yet where it should be. I very humbly say that I think I have been very, very lucky or blessed. As I introduced, holding a master's degree or 2 master's degrees and having a basic medical degree, all of them under scholarship, I find myself like God has trained me to come and serve others. And so whenever I wake up, I know that there is work to do. Because the day before, the previous day, there was somebody looking for my help. And that work that is yet undone keeps me motivated. Woman, and I am very, very passionate about this. Nobody fell from the sky. A woman is so important.
Yes.
No matter what people may have said in time past, a woman is supreme. But you and I know abuse, all sorts of things are happening out there, hurting the woman. If I can reach my sisters, at my age, I do have mature children, and everybody that fits into the age of my own children, if I can reach my children, I feel happy. If I can counsel someone to take the right step towards health promotion, towards prevention of cervical cancer or any disease, I get more and more motivated. So yes, there is work to do. Yes, we need to save women. Yes, we need to keep mothers alive for their children. All that motivates me. And don't get me wrong, in closing, a perfect family is a mother and father. Anything that keeps